Miss Pat, tell us about the first time you came to see Dr. Scott. Why you came to see him?
Well,
Why?
because I was having trouble with my dentures kicking up. Um, and I did a lot of singing and public speaking, and I was just in dread all the time. The lower plate just wouldn't stay in place, and so I had to keep them glued in, and I just wasn't happy with it. And so I just come and I knew he'd do something about it, and he did. Sure did.
And you have what's called a sub-periosteal implant on the lower, which is an artificial jawbone.
Right.
And how has that worked for you over the years?
How has I can't tell you the freedom that I've had. Well, it was in '86, and at that time I was doing a lot of public speaking and singing, and I was in nursing, and well, you have to be yourself. That's all. And I was just totally, I don't know, just sick of my mouth. I wasn't happy with it. I couldn't be satisfied with the way I looked. I just didn't like the way I looked. And I know that's vanity, but when you're in a public speaking, you got to be sure of your mouth. You got to be sure when you're talking that these dentures don't jump up out of your mouth. And I've always never had anything like that happen because I learned to control them as soon as I got them. And I've had dentures since I was 18, 19 years old because my teeth were really crumbly and wouldn't hold fillings. And so I had to get the dentures then. And so started at an early age. But then, you know, when you stand before a group of people, you want to look your best. And you can't look your best when you're scared to death what your teeth are going to do. And so that's where I was, just scared to death that I wasn't going to be able to control these. I saw in the paper, the Sunday paper, this great big advertisement of, of Byron's and talking about the sub-periosteal, yeah. And
Sub-periosteal.
I said, that's for me. I'm going to do it. And I was working, and I could afford to do it, and I could trust him. I knew what he would do. I knew he would do the best he could for me. So I went to see my little friend, and of course he grew 10 feet tall when he showed me, when I saw my beautiful smile the first time. I just loved it. I loved it. And so he made dentures, new dentures, and put the implant in at the same time. And people are amazed that I have the false teeth. They're just amazed. Those are not your real teeth. And I can say, no, they're not.
And I wouldn't tell
You know
anybody.
what I do? I say, yeah, they're mine. I paid for them. They belong to me. And really, this is the second uh, upper because Byron and I didn't really like the way the others looked. And so I'm sounding corny, I know. But when he put these in, I was sold forever. And the upkeep is just, well, there is no upkeep. There isn't. I have to take care of the bone in the lower jaw. That I just got a lecture from my dentist because I wasn't coming as I should, and I'm ashamed of that. But I trust my dentist, and I've sent many people that have gone on to be with Jesus. They've just gone to Jesus with their lower dentures in because you don't ever take them out anymore. And I can't tell you how happy I've been with them. And I don't think about having false teeth. I don't think about it. And
Think how pretty your teeth are.
yes, yes. And two, when I get before a mirror, and you do that when you're going to go somewhere to speak or to sing. And when I first got the lower sub-periosteal implant, and I did my thing before the mirror, I cried the first time because they were so pretty. My teeth were so pretty, and I felt so comfortable with my teeth.
And confident.
I think they're just beautiful, and I'm just really vain about my false teeth. I really appreciate what God has done for me through my dentist.